Question 1. A medical assistant is preparing to clean a spill of body fluids. Which of the following personal protective equipment, PPE, should the assistant don first? A. Surgical mask. B. Face shield. C. Gloves. D. Gown. Answer: C. Gloves. This question tests knowledge of proper infection control and the sequence for donning personal protective equipment, PPE. The keyword first is crucial, indicating the initial step in a series of actions. When dealing with body fluids, gloves are always the first piece of PPE to put on to protect the hands from direct contact and prevent the spread of microorganisms, as hands are the primary contact point. For instance, if a blood spill occurs, the first step after assessing the situation would be to put on gloves before attempting to clean it up. Always remember that direct hand protection is the immediate priority for tasks involving potential exposure to infectious materials. Question 2. Which of the following suffixes means surgical removal? A. Ectomy. B. Ostomy. C. Otomy. D. Algia. Answer: A. Ectomy. This question assesses fundamental medical terminology, specifically the meaning of common suffixes. The keyword surgical removal directly points to the definition of a specific suffix. The suffix ectomy is consistently used in medical terms to denote the excision or removal of an organ or part, such as in an appendectomy, removal of the appendix. In contrast, ostomy means to create an opening, otomy means to make an incision, and algia refers to pain. Understanding these basic building blocks of medical words helps in deciphering complex terms. Question 3. When measuring a patient's blood pressure, the medical assistant should inflate the cuff to approximately what level above the patient's usual systolic pressure or when the radial pulse is no longer palpable? A. 10 to 20 millimeters of mercury. B. 30 to 40 millimeters of mercury. C. 50 to 60 millimeters of mercury. D. 70 to 80 millimeters of mercury. Answer: B. 30 to 40 millimeters of mercury. This question focuses on the correct technique for accurately measuring blood pressure, a core clinical skill. The key phrase above the patient's usual systolic pressure or when the radial pulse is no longer palpable guides the learner to the standard practice for cuff inflation. Inflating the cuff 30 to 40 millimeters of mercury above the estimated systolic pressure or the point where the radial pulse disappears ensures that the cuff is adequately inflated to occlude the artery, preventing an auscultatory gap and providing an accurate reading. For example, if a patient's usual systolic is 120 millimeters of mercury, inflating to 150 to 160 millimeters of mercury is appropriate. This practice prevents underestimation of systolic pressure, which is crucial for patient safety. Question 4. A medical assistant is communicating with a patient who is visibly upset about a recent diagnosis. Which of the following is the most appropriate response? A. I understand how you feel, I've been upset before too. B. There's no need to worry, everything will be fine. C. It sounds like you're feeling really overwhelmed right now. D. Let's focus on the positive aspects of your treatment plan. Answer: C. It sounds like you're feeling really overwhelmed right now. This question tests the essential communication skill of active listening and demonstrating empathy, especially in sensitive situations. The keywords visibly upset and most appropriate response highlight the need for a patient-centered approach. Responding with "it sounds like you're feeling really overwhelmed right now" validates the patient's emotions and shows that the medical assistant is actively listening and attempting to understand their perspective without minimizing their feelings or offering false reassurances. For instance, if a patient expresses fear, acknowledging that fear directly helps build trust. Always remember to acknowledge and reflect the patient's feelings to foster a supportive environment. Question 5. Which of the following is the correct order of draw for a venipuncture collection, assuming all listed tubes are required? A. Light blue, red, green, lavender. B. Red, light blue, lavender, green. C. Green, lavender, light blue, red. D. Lavender, green, red, light blue. Answer: A. Light blue, red, green, lavender. This question assesses knowledge of the critical venipuncture procedure known as the order of draw, which prevents cross-contamination of additives between tubes. The keyword correct order of draw emphasizes the standardized sequence to ensure accurate lab results. The generally accepted order begins with sterile blood culture tubes, if needed D, followed by light blue, coagulation, red, serum, green, heparin/plasma, and then lavender, EDTA/hematology. For example, drawing a light blue tube before a lavender tube prevents EDTA from contaminating the coagulation sample. Following this strict protocol is essential for the integrity of laboratory tests. Question 6. The sagittal plane divides the body into which of the following sections? A. Upper and lower portions. B. Anterior and posterior portions. C. Right and left portions. D. Medial and lateral portions. Answer: C. Right and left portions. This question tests foundational knowledge of anatomical planes, which are imaginary lines used to describe the location and direction of structures within the body. The keyword sagittal plane specifically refers to one of these standard divisions. A sagittal plane runs vertically, dividing the body or an organ into right and left segments. For instance, if you were to draw a line straight down the middle of a person's face and body, that would be the median sagittal plane. Understanding these planes is crucial for accurately describing anatomical locations and surgical approaches. Question 7. The Health Insurance Portability and Accountability Act, HIPAA, primarily focuses on which of the following? A. Regulating medication dosages. B. Standardizing medical billing codes. C. Protecting patient privacy and health information. D. Establishing guidelines for medical equipment sterilization. Answer: C. Protecting patient privacy and health information. This question evaluates understanding of a critical legal and ethical standard in healthcare. HIPAA. The keyword primarily focuses on, directs attention to the core purpose of this legislation. HIPAA's main objective is to protect the privacy and security of individuals' health information, ensuring that patient data is handled confidentially and securely. For example, a medical assistant must ensure that a patient's chart is not left open where others can see it or that patient information is not discussed in public areas. Always remember that HIPAA is fundamental to maintaining patient trust and confidentiality in all medical settings. Question 8. When performing a 12-lead electrocardiogram, ECG, the V4 electrode is placed at which anatomical location? A. Fourth intercostal space, right sternal border. B. Fourth intercostal space, left sternal border. C. Fifth intercostal space, midclavicular line. D. Fifth intercostal space, anterior axillary line. Answer: C. Fifth intercostal space, midclavicular line. This question assesses a crucial skill in clinical procedures, correct electrode placement for a 12-lead ECG. The specific electrode V4 requires precise anatomical knowledge. The V4 electrode is placed in the fifth intercostal space, the space between the fifth and sixth ribs, at the midclavicular line, an imaginary line drawn straight down from the middle of the collarbone. Accurate placement of all leads, like V4, is essential to ensure a diagnostic quality ECG tracing that can correctly identify cardiac abnormalities. Incorrect placement, for example, could lead to a misdiagnosis. Question 9. Which of the following is the most efficient method for a medical assistant to manage appointment scheduling to minimize patient wait times and optimize provider availability? A. Double booking all appointments. B. Open hours scheduling. C. Wave scheduling. D. Stream scheduling, fixed appointment scheduling. Answer D. Stream scheduling, fixed appointment scheduling. This question evaluates knowledge of effective office administration practices, specifically appointment scheduling methods. The keywords most efficient method and minimize patient wait times and optimize provider availability point to a system designed for predictable flow. Stream scheduling, also known as fixed appointment scheduling, assigns patients specific times for their appointments, which helps create a steady flow and reduces bottlenecks. For instance, if patients are scheduled every 15 minutes, it helps the medical assistant anticipate arrival times and manage the provider's day. While other methods exist, stream scheduling is generally considered the most efficient for consistent patient flow and resource utilization. Question 10. A medical assistant is preparing to administer medication to a patient. Which of the following rights of medication administration should the assistant check first? A. Right time. B. Right patient. C. Right dose. D. Right route. Answer B. Right patient. This question tests the fundamental safety protocol known as the 5 rights of medication administration. The keyword first emphasizes the initial and most critical step in this sequence. Ensuring the right patient is paramount because administering medication to the wrong individual can have severe, even fatal, consequences. For example, before even considering the medication itself, the medical assistant must verify the patient's identity using 2 identifiers, such as their name and date of birth. Always confirm you have the correct patient before proceeding with any other steps. Question 11. Which of the following is the most appropriate method for collecting a urine specimen for a culture and sensitivity test? A. Random specimen. B. First morning void. C. Clean catch midstream. D. 24-hour collection. Answer C. Clean catch midstream. This question assesses knowledge of proper laboratory procedures, specifically the correct method for urine collection for specific tests. The phrase culture and sensitivity test is the key clue, as this test requires a specimen free from external contamination. A clean catch midstream collection involves the patient cleaning the urethral area, starting to void, then collecting the middle portion of the urine flow, which significantly reduces the presence of normal flora from the skin. For example, a random sample would likely be too contaminated for an accurate culture. This method helps ensure that any bacteria found in the urine are truly from the urinary tract, not external sources. Question 12. Which of the following body systems is primarily responsible for the production of hormones that regulate metabolism, growth, and reproduction? A. Nervous system. B. Endocrine system. C. Lymphatic system. D. Muscular system. Answer B. Endocrine system. This question tests basic knowledge of human anatomy and physiology, specifically the functions of the major body systems. The keywords production of hormones and regulate metabolism, growth, and reproduction directly point to the primary role of the endocrine system. This system consists of glands that secrete hormones into the bloodstream, which then travel to target cells or organs to regulate various bodily functions. For instance, the thyroid gland, part of the endocrine system, produces hormones that control metabolism. Understanding the roles of each system is foundational for comprehending human health. Question 13. A medical assistant is assisting a patient who suddenly collapses in the waiting room. After ensuring the scene is safe, what is the immediate next step in providing emergency care? A. Administering rescue breaths. B. Checking for a pulse and breathing. C. Retrieving the automated external defibrillator, AED. D. Performing chest compressions. Answer, B. Checking for a pulse and breathing. This question focuses on immediate actions during a medical emergency, a crucial aspect of a medical assistant's role. The keyword immediate next step after ensuring scene safety is vital. The first assessment after confirming safety and calling for help is to check for signs of life, specifically a pulse and breathing, to determine if the patient is in cardiac arrest or simply unconscious. For example, if no pulse is found, then chest compressions would be initiated. This systematic approach ensures that appropriate interventions are started promptly based on the patient's condition. Question 14. Which section of a SOAP note would include the patient's chief complaint and symptoms described in their own words? A. Subjective. B. Objective. C. Assessment. D. Plan. Answer. A. Subjective. This question tests knowledge of medical documentation, specifically the structure of a SOAP note, which is a common method for recording patient encounters. The keywords chief complaint and symptoms described in their own words are direct indicators of the subjective section. This part of the note captures information directly reported by the patient or their family, reflecting their perspective and experiences. For example, if a patient states, "I've had a dull ache in my lower back for 3 days," this would be recorded in the subjective section. The subjective section is vital for understanding the patient's personal experience of their condition. Question 15. When preparing a patient for a gynecological exam, the medical assistant should instruct the patient to assume which position? A. Supine position. B. Prone position. C. Lithotomy position. D. Fowler's position. Answer, C. Lithotomy position. This question assesses knowledge of patient positioning for specific clinical procedures. The keyword gynecological exam is the key clue for identifying the appropriate patient position. The lithotomy position involves the patient lying on their back with their feet in stirrups, which provides optimal exposure for a gynecological examination. For example, a patient would be positioned this way for a Pap test. Understanding the correct positioning for various exams is crucial for patient comfort, safety, and allowing the provider to perform the procedure effectively. Question 16. Which of the following is considered a Category I task under OSHA's bloodborne pathogen standard, meaning it involves exposure to blood or body fluids? A. Scheduling patient appointments. B. Taking vital signs. C. Phlebotomy. D. Documenting patient history. Answer, C. Phlebotomy. This question assesses understanding of OSHA's bloodborne pathogen standard, particularly the classification of tasks based on exposure risk. The keyword Category I task and the phrase involves exposure to blood or body fluids are crucial. Phlebotomy, which is the process of drawing blood, inherently involves direct contact with blood and is therefore classified as a Category I task. For example, a medical assistant performing a blood draw is at direct risk of exposure and must follow all blood-borne pathogen precautions. Tasks like scheduling or taking vital signs typically do not involve direct exposure. Question 17. The prefix Brady dash means which of the following? A. Fast. B. Slow. C. Pain. D. Without. Answer B. Slow. This question tests foundational medical terminology, specifically the meaning of common prefixes. The prefix Brady dash consistently indicates slowness or a reduced rate. For example, bradycardia refers to a slow heart rate, and bradypnea refers to slow breathing. Understanding prefixes like Brady dash is essential for decoding and comprehending a wide array of medical terms, aiding in clear and accurate communication in healthcare. Question 18. Which of the following methods for taking a patient's temperature is considered the most accurate for measuring core body temperature? A. Axillary. B. Tympanic. C. Oral. D. Rectal. Answer D. Rectal. This question focuses on the accuracy of different methods for measuring body temperature. The keyword most accurate for measuring core body temperature is the key indicator. Rectal temperature is generally considered the most accurate method because it measures the temperature closest to the body's internal organs, reflecting the true core temperature. For example, a rectal temperature is often used for infants or critically ill patients when extreme precision is required. While other methods are convenient, rectal measurement provides the most reliable indicator of internal body heat. Question 19. When applying a tourniquet for venipuncture, how far above the venipuncture site should it be placed? A. 1 to 2 inches. B. 3 to 4 inches. C. 5 to 6 inches. D. 7 to 8 inches. Answer B. 3 to 4 inches. This question assesses knowledge of proper venipuncture technique, specifically the correct placement of a tourniquet. The keyword how far above is crucial for appropriate application. A tourniquet should be applied 3 to 4 inches above the intended venipuncture site to allow for adequate venous engorgement without impeding arterial flow, which could affect blood quality. For example, if you plan to draw blood from the antecubital fossa, the tourniquet would be placed just above that area. Proper tourniquet placement is essential for successful and safe blood collection. Question 20. A medical assistant's scope of practice prohibits them from performing which of the following tasks? A. Administering an intramuscular injection. B. Interpreting laboratory results for a patient. C. Taking a patient's vital signs. D. Assisting with minor surgical procedures. Answer B. Interpreting laboratory results for a patient. This question tests understanding of a medical assistant's legal and ethical scope of practice, which defines the procedures they are legally permitted to perform. The keyword prohibits highlights actions that are outside their authorized duties. Interpreting laboratory results, making diagnoses, or prescribing treatment are tasks reserved for licensed healthcare providers, not medical assistants. For example, while an MA can tell a patient a lab result as directed by the physician, they cannot explain what the result means or what action the patient should take based on it. Adhering to the scope of practice ensures patient safety and legal compliance. Question 21. When administering an intramuscular (IM) injection to an adult patient in the deltoid muscle, what is the maximum volume of medication that should typically be injected? A. 0.5 ml. B. 1 milliliter. C. 2 milliliters. D. 3 milliliters. Answer B. 1 milliliter. This question assesses knowledge of safe intramuscular injection techniques, specifically the maximum volume for the deltoid muscle. The keywords intramuscular, IM, injection, adult patient, and deltoid muscle are critical, as injection volumes vary by site and patient age. For the deltoid muscle, a maximum volume of 1 milliliter is generally recommended to prevent tissue damage and discomfort due to the muscle's relatively small size. For example, if an adult requires a flu shot, it's typically a 0.5 ml dose in the deltoid. Larger volumes typically require a different injection site, such as the vastus lateralis or gluteal muscle. Question 22. Which of the following forms is completed by a new patient and provides demographic information, medical history, and insurance details? A. Superbill. B. Encounter form. C. Patient registration form. D. Consent for treatment form. Answer C. Patient registration form. This question assesses knowledge of standard office administration procedures, specifically regarding patient intake forms. The description, demographic information, medical history, and insurance details are key characteristics of a patient registration form. This form is fundamental for creating a new patient record, ensuring accurate billing, and providing the provider with necessary background information. For example, when a new patient arrives for their first appointment, completing this form is usually the initial step. It serves as the comprehensive collection of essential patient data. Question 23. A patient is prescribed an antibiotic for a bacterial infection. This medication belongs to which general drug classification? A. Analgesic. B. Anticoagulant. C. Anti-inflammatory. D. Anti-infective. Answer D. Anti-infective. This question tests basic pharmacology knowledge, specifically drug classifications based on their therapeutic action. The keywords antibiotic and bacterial infection are direct clues. Antibiotics are a type of anti-infective medication specifically designed to treat bacterial infections by killing or inhibiting the growth of bacteria. For example, penicillin is an antibiotic used to treat various bacterial illnesses. Understanding these broad categories helps in recognizing a medication's purpose. Question 24. Which of the following types of laboratory tests can a medical assistant typically perform in the clinic setting under CLIA-waived regulations? A. Complete blood count, CBC. B. Urinalysis, dipstick only. C. Blood culture. D. Arterial blood gas, ABG. Answer B. Urinalysis, dipstick only. This question focuses on the regulatory guidelines for laboratory testing, specifically CLIA-waived tests that medical assistants can perform. The keyword CLIA-waived regulations is crucial, indicating tests with a low risk of error that can be performed in a non-laboratory setting. While medical assistants cannot perform complex tests like a CBC or ABG, a basic urinalysis using a dipstick is a common CLIA-waived test. For example, testing a urine sample for the presence of glucose or protein with a reagent strip is a waived test often performed in a medical office. Always confirm your facility's specific policies and your certification's scope for waived testing. Question 25. A medical assistant notices a patient struggling to understand the post-procedure instructions, despite them being clearly written. Which of the following actions demonstrates effective patient communication and empathy? A. Repeating the instructions louder and slower. B. Asking the patient, "Do you have any questions?" C. Offering to review the instructions verbally and demonstrate if possible. D. Giving the patient a different, simpler handout. Answer C. Offering to review the instructions verbally and demonstrate if possible. This question assesses effective patient communication, especially when a patient is having difficulty understanding complex information. The keywords struggling to understand and effective patient communication and empathy highlight the need for a tailored approach beyond simply repeating or simplifying. Offering to review instructions verbally and demonstrating practical steps, such as how to change a dressing, helps cater to different learning styles and ensures comprehension. For example, instead of just saying, change the bandage daily, showing them how to remove and apply a new one is much more effective. This proactive approach shows compassion and a commitment to patient education.